Welcome back. The skyrocketing cost of healthcare is something we all deal with, and navigating the complex world of insurance when you have a procedure or a health challenge can be overwhelming. Now, just as Governor Lamont announced he's running for a third term, he started talking about something called the CT option, the Connecticut option. How much does it cost? What is it? Will it work? Comptroller Sean Scanlon is here. Welcome back. He was playing a big part in trying to move this forward with the administration. And you also administer state employee health care as part of your job to make sure that that's moving forward properly. What is the CT option?
The CT option is basically creating a new choice to provide affordable health care to people like small business owners or nonprofits or individuals, frankly, who are getting really hurt by the high cost of health care right now. And if we want to make the state more affordable, when it comes to all the different things we hear about, healthcare is one of the biggest ways we can do it, and the Connecticut option is how we can do that. So
your predecessor, Kevin Lembo, was all about single payer, wanted to try to move forward. Is this a version of that? Is it similar? How does it work?
What the Connecticut option is all about is leveraging what I already do as the comptroller, running, as you just mentioned, the largest healthcare plan in the state for employees, 250,000 people. We have the power and the leverage that a small business owner of 3 or 4 people does not have. And if I can work with that small business owner to provide the leverage that I have to give them an affordable product, it's going to be good for our whole state. And yes, it will inject some competition into a market that I think is really desperate for competition. In my mind, the healthcare system we live in is broken and unaffordable for too many people, and it's time for us to think big and be bold, and the Connecticut option is just that.
So, for argument's sake, hypothetically, I own Hydex Hardware, 25 employees. I want to make sure they have health insurance. They're not going to call in sick as much if they go to the doctor on a regular basis and don't skip appointments. How would something like that start out?
You buy into a plan either on or off the Connecticut Health Insurance Exchange, which is called Access
Health. So
off
too, it doesn't have to be on.
It does not have to be on. It can be designed for either or. The plan is designed by a board that I, as the state comptroller, run, and then folks will be able to look at how they can stack up versus our plan versus what they can see on the private market. The second thing that we can also do is try to steer people towards the lowest cost and highest quality care. Yukon Health, for example, we're now working to expand that system and provide some competition in the marketplace. And I think if we can start steering people towards the care that's lower cost and higher quality, we can save money. We do that on the state employee plan. I want to do it with the Connecticut option.
So where is this now, and how likely is it to come to fruition? Does it have to go through the state legislature still? Where is it in the process?
Yeah, look, the governor came out and said it was one of the biggest things he wanted to get done in his next term. If he's given that next term by the voters, it's something I've wanted to do for 7 or 8 years, and I'm excited to be partnering with him and our partners in the legislature to work on this going forward. It's not something that can happen overnight. It's going to take some time to design it, but I'm confident that we can get it done, and I know that we need to because the people of Connecticut are just fed up with the high cost of health care. They want us to act, and this is the best way we can do it.
So one of the things that I find interesting moving forward, a challenge that could possibly happen, how would costs be controlled? So one of the things the state was concerned with in recent years is the GLP-1 drug. It's cost our state a lot of money on the exchange because so many people are using it now. What happens if costs spike for whether it's a market thing like GLP-1 or statistically a lot of people on the plan get sick in 1 year and it costs a lot of money? How do you mitigate that?
Well, costs spike all the time. That's part of what health insurance and risk pooling is all about, and we're going to make sure that that plan is airtight and that the taxpayers are not on the hook for any overages that there are. You can certainly do that in a health plan based on the way you design it, but at the end of the day, what we want to make sure is that when those costs are spiking to get the care that you need or a procedure done or you get this diagnosis that you didn't expect to get, that you're going to have a health insurance product that's going to make you be able to get the care that you need. And right now, that's just not the reality for many people in our state, especially those small business owners and the nonprofit leaders that make up the backbone of our local communities. We want to give them an affordable option, and that's what this is all about.
Is there a goal when you say affordable option at price points at certain, would it be based on income tier level? Would it be based on the number of employees you have in your business? How do you meter all that out and figure out where people fit into slots considering what kind of coverage they want?
A lot of it depends on where we're going to be at and what the plan final design is, but if we can get somewhere between 10 and 20% of a more affordable than it is today, I think most people would say that that's way, way better in the right direction. But the final product is going to be determined on all these different things that are going to happen. But if you're out there right now and you're wondering what this is going to be, the end of goal of it is just to try to make sure we're going to try to make more competition in the system that leads to you having more affordable health care.
Last question, I got about 30 seconds. The last time this was discussed in a big fashion, the insurance companies threatened Governor Lamont, sent an email, we're going to leave Connecticut. What happens if that happens again?
Look, I think the conditions have changed. A lot of these same insurance companies that tried to stop this from happening last time have left the market. They're no longer offering products in this space. But at the same time, I think you also hear people like the governor standing up and saying, look, I said to them, let's work on this. I don't necessarily think this is the best option, but if you got a better idea, I'm open. They have never come forward with a better idea, and all they've done in the meantime is jack up the rates after rates after rates for people of Connecticut. And I think whether it's the governor or the small business owner in your downtown, everyone knows the system is broken and we have to fix it, and this is how we can do it.
We'd like to have you back when it moves forward. Comptroller Scanlon,
Good to be
see
on.
you.